Hospital, and I'm here with our consultant ophthalmologist, Mr. Hadi Zambarakji. Could you just introduce yourself?
Good morning, Charlotte. My name is Hadi Zambarakji. I'm a consultant ophthalmologist at Spire London East Hospital, and I think we're going to talk today about distortion of vision and possible causes and possible treatments.
Yep, so we've got a few questions to go through. First question, what does distortion mean, and is it different from having blurred vision?
Patients who present with distorted vision usually have a problem with a part of the retina called the macula. And this is slightly different from having blurred vision, although in the later stages, the two become very much part of the same problem, and patients with distortion may not necessarily report distortion, but will just say my vision is very blurred. What it usually means is that there is a problem with the macula, that part of the retina which is responsible for central vision. And there are, of course, different possible causes as to why patients with distortion may have these symptoms.
Perfect. Which part of the eye is responsible for giving us clear and undistorted images?
So that's what I just said earlier. That's the macula, obviously. And in the context of distortion, usually the common causes of distortion include something called an epiretinal membrane, or like a wrinkling of the surface of the retina, possibly a macular hole, which is a hole in the central macula. And other possible causes include things like diabetic maculopathy, so diabetic retinopathy, or possibly macular degeneration. So these are the four common things that can cause distortion.
Great, okay. Can I get rid of the distortion that I'm experiencing?
Yes, well, this is obviously the clue here is to try and understand what's the actual underlying problem, and then try and fix the problem. If it's something called an epiretinal membrane, as I mentioned earlier, then this is a surgical problem. You have to basically do what we call a vitrectomy and peel the membrane away, the membrane which is causing the distortion. And usually patients experience significant improvements after surgery and a reduction in distortion. With patients with macular holes, if this is also a surgical problem, and again, the treatment quite often relieves the distortion to a significant extent. So the treatment is aimed at closing the macular hole, and this is also treated through surgery called a vitrectomy procedure, which is the same procedure that is done for the epiretinal membrane. For patients with macular degeneration or diabetic macular edema, then the treatment is different, because usually the treatment involves intravitreal injections, so injections inside the eye to reduce the thickening of the retina and therefore reduce the distortion. So the treatment is different depending on what the underlying problem is, of course.
Okay, so say someone did have distorted vision, they would come to you, you'd be able to find out what the issue was and then recommend the best treatment.
Yes,
from that.
So what we would do is we would take a history, examine the patient, and do a scan of the retina. These scans are very high resolution scans called an OCT scan, or an optical coherence tomography scan. And these scans essentially show us retinal structures. It shows us what's happening inside the retina and allows us to differentiate one problem versus another. But quite often the history also tells you what is the likely diagnosis. So for example, a patient with macular degeneration in one eye who comes in with distortion in the second eye, you know the most likely underlying reason is going to be the same problem, i.e. the macular degeneration.
Lovely, okay. So what should a patient do if he or she wakes up one morning and they've got distorted vision? Should they come see you?
Usually the problem doesn't happen overnight. Usually the patients will notice these symptoms over a period of time. So it could be days, it could be weeks. But the important thing is that if it's mild and long-standing, it's not urgent. If it's happened reasonably quickly, and in particular if it's in a patient with macular degeneration in one eye, then you know time is important to treat. So in which, in this context, it's important to treat quickly, basically. So with macular degeneration, for example, if one eye has become affected and the patient presents with symptoms in the fellow eye, in the good eye, then it is important that they report the symptoms quickly so we can identify the problem and treat. As I said, with more longer standing symptoms, and particularly if they're mild, then it's not as urgent, and patients just need to basically give us, make an appointment and arrange to be seen.
Lovely. Okay, thank you so much. Thank you everyone for watching today. I will put the details of Mrs. Zambarakji's clinic in the comments as well, but please give us a call or send us an email if you're interested. And thank you so much for talking to us today.
Charlotte, thank you very much for your time. Thank you very much again. Thank you.